So I will begin today with an update on the Ebola situation in Africa and what it means for Canada. And then I will provide an update on the Andes hantavirus. So on May 15th, Africa's Centers for Disease Control and Prevention declared an outbreak of Ebola disease in the Eastern Democratic Republic of Congo. Cases linked to this outbreak have also been reported in Uganda, including an imported strain that was confirmed to be the Bundibugyo virus strain. On May 17th, the Director General of the World Health Organization declared this outbreak a public health emergency of international concern due to the evidence of cross-border spread, uncertainty around the true size of the outbreak, the potential for wider regional and global impacts, and the need for global collaboration. It's important to be clear that while this is a serious and evolving situation, cases remain localized and the global risk is low. Cette éclosion se trouve dans une région confrontée à des défis complexes, notamment la proximité de centres urbains, des problèmes de sécurité et des niveaux élevés de mouvements de population liés à l'activité minière. Ces facteurs peuvent accroître le risque de propagation aux échelles locales et internationales. Nous reconnaissons que le risque pour les personnes vivant dans la région concernée est élevé. Et nos pensées vont aux personnes, aux familles, aux communautés et aux professionnels de la santé qui subissent directement les conséquences de cette éclosion complexe. Le Canada est prêt à apporter son aide. Based on the Public Health Agency of Canada's rapid risk assessment and in alignment with the World Health Organization, the risk to people in Canada is considered to be low at this time. There has never been a case of Ebola disease imported into Canada despite numerous Ebola outbreaks in the affected region. I do, however, want to be transparent that out of an abundance of caution, one individual in Ontario underwent precautionary testing. This individual recently returned from Ethiopia and reported symptoms that were consistent with a range of illnesses. Both the initial testing that was conducted in Ontario as well as confirmatory testing at the National Microbiology Laboratory were negative. So this is a good example of how quickly measures are activated, even when the likelihood of Ebola here in Canada is low. Ebola disease is transmitted through direct contact with the body fluids of an infected individual who is showing symptoms, or through contact with infected animals or contaminated materials. It is not spread through casual contact, and it does not spread through the air like respiratory viruses. Those at highest risk are individuals providing care to patients with Ebola disease, those participating in burial practices involving direct contact, or those working in healthcare or laboratory settings where the virus is present. Bien que le risque au Canada reste faible, nous prenons cette situation très au sérieux et adoptons une approche de précaution. L'Agence de la santé publique du Canada surveille activement l'éclosion en étroite collaboration avec ses partenaires internationaux, notamment l'Organisation mondiale de la santé, ainsi qu'avec les autorités de santé publique provinciales et territoriales. À nos frontières, nous avons renforcé les mesures de dépistage. Depuis le 20 mai, des questions de dépistage approfondies sont posées aux kiosques des aéroports aux voyageurs qui se sont rendus en République démocratique du Congo ou en Uganda au cours de les 21 derniers jours. On demande désormais aux voyageurs qui se sont rendus dans ces pays s'ils présentent des symptômes ou s'ils ont pu être en contact avec une personne atteinte de la maladie Ebola. Nous avons également déployé des agents supplémentaires chargés de la quarantaine et du dépistage dans les principaux aéroports. Et nous avons maintenant un système de surveillance centralisé fonctionnant 24 heures sur 24, 7 jours sur 7. Des affiches ont été installées dans les principaux aéroports du pays, informant les voyageurs sur les procédures à suivre s'ils ne se sentent pas bien.
if they feel
Ces mesures
unwell.
s'appuient sur la loi sur la mise en
These measures
quarantaine
are supported
et
under the
visent à
Quarantine Act
détecter rapidement les
and are
risques
designed to
potentiels
identify
et à
potential risks
garantir que les
early
mesures de suivi
and
appropriées
ensure that
soient prises.
appropriate follow-up actions are taken.
On Wednesday, a flight was redirected to Montreal due to a passenger of concern. FACT quarantine officers assessed the individual, determined they were asymptomatic, and appropriate border procedures were followed. For travelers, I want to emphasize the importance of checking the Government of Canada's travel advice and advisories before departure. Individuals returning from affected regions should monitor their health for 21 days. If symptoms develop, it is critical that they isolate immediately, away from others, and contact local public health authorities before seeking in-person care. Le Canada dispose des solides systèmes de
Canada
laboratoire et
has
de surveillance.
strong laboratory and
Tout
surveillance
cas
systems in
suspect au
place.
Canada serait immédiatement
Any
signalé
suspected
et
case
des
in Canada
échantillons
would be
seraient
immediately
envoyés au
reported,
Laboratoire
with
national de
samples sent
microbiologie
to the National
de Winnipeg
Microbiology Laboratory
pour
in
des tests de
Winnipeg
confirmation.
for
Les
confirmatory
résultats
testing.
sont généralement disponibles dans les
Results are
24 heures
typically available
suivant
within
l'arrivée
24
des
hours
échantillons au
once the
laboratoire.
samples arrive at the lab.
Notre laboratoire national de microbiologie
Our
continue
National
de jouer un
Microbiology
rôle de premier
Laboratory
plan à l'échelle
continues to
mondiale
play a
dans la
leading
recherche
role
sur le
globally
virus Ebola,
in Ebola
notamment dans
research,
le domaine des vaccins,
including
des traitements et
work
des
on
diagnostics.
vaccines,
Les
therapeutics, and
scientifiques
diagnostics.
canadiens ont joué un rôle déterminant
Canadian
dans la mise
scientists
au point
were
de premiers
instrumental
vaccins contre
in
le
the
virus
development
Ebola
of the world's
au monde.
first Ebola
Et ils
vaccine,
continuent de contribuer aux
and they
efforts de
continue to
préparation et
contribute to
d'intervention à
preparedness
l'échelle
and response
internationale.
efforts internationally.
This outbreak underscores the importance of global collaboration. Canada continues to work closely with international partners through established mechanisms such as the World Health Organization and the Global Outbreak Alert and Response Network. We stand ready to provide technical expertise and support if requested, as we have done in previous outbreaks. Our shared goal is to contain this outbreak at its source and reduce the further spread. I will now turn briefly to the situation regarding Andes hantavirus. So Canada has confirmed a case of Andes hantavirus linked to the MV Hondias cruise ship earlier this month. At this time, there have been no additional cases identified in Canada beyond the initial confirmed case in British Columbia, and all high-risk contacts continue to be monitored by local public health authorities. The overall risk to the general population in Canada remains low at this time. Nous continuons d'adopter une approche de précaution compte
We
tenu de la
continue to take a
gravité de ce
precautionary
virus,
approach
tout
given
en
the
reconnaissant que
severity
la
of this
transmission
virus,
interhumaine de
while
antivirus
recognizing
entre
that
est
person to
rare
person
et nécessite
transmission of
généralement un
Andes
contact
hantavirus
étroit
is rare
et prolongé
and
avec une personne
typically
présentant des
requires
symptômes.
close, prolonged
Nos
contact with someone
pensées
who is
vont à la
symptomatic.
personne hospitalisée
Our
en
thoughts are with the
Colombie-Britannique
individual
et à
in
sa famille.
hospital in British
Nous
Columbia
remercions
and
nos
their
collègues
family.
de la santé publique
We thank
ainsi
our
que
public
l'équipe
health colleagues
soignante pour
as well
l'excellente
as the
prise en
clinical
charge et
team
le
for
soutien
the excellent
qu'ils
care
lui
and
apportent.
support they are providing.
Cette semaine, j'ai eu l'occasion d'assister à
This week, I had the
l'Assemblée
opportunity
mondiale de
to
la
attend
santé à
the
Genève,
World Health
où j'ai
Assembly
rencontré
in
plusieurs de
Geneva,
mes homologues
where I met with a
internationaux
number of my
afin
global
de discuter des
counterparts
défis de santé
to
publique
discuss
auxquels
the
nous sommes
public
tous
health
confrontés.
challenges we all face.
J'ai également rencontré le Dr Ghebreyesus,
I also met
directeur général de
Dr.
l'Organisation
Ghebreyesus,
mondiale de la santé,
Director General of the
ainsi que
World
des
Health
membres de son
Organization,
équipe de
and
direction
members of his
qui
senior
dirigent
leadership
les
team
interventions
who are leading
d'urgence,
emergency
notamment la
response,
réponse à la maladie
including
Ebola
the
en
Ebola response
RDC.
in DRC.
Ces discussions ont réaffirmé
These
l'importance de
discussions
la transparence,
reinforce
de
the
la
importance
communication
of
rapide, de
transparency,
l'information et
timely
de la
information sharing,
coordination
and
pour
coordination
répondre efficacement aux
to respond
menaces émergentes
effectively
en
to
matière de
emerging
santé
public
publique.
health threats.
Les événements de ces dernières semaines ont
The events of the
démontré
past
que des
several weeks
relations
have
internationales
demonstrated
solides ne
that
sont pas
strong
seulement
global
précieuses,
relationships
elles
are
sont
not only valuable,
essentielles.
they are essential.
So in conclusion, We have a robust system in place for detection, prevention, and response. We are working in close collaboration with provincial and territorial partners, as well as with international organizations and governments to ensure a coordinated and effective approach. We will continue to provide timely updates and clear guidance as new information becomes available. I want to send out a special thank you to our public health partners across the country, our frontline healthcare workers, lab scientists, and our international colleagues for their dedication, their expertise, and collaboration. Together, we are working to protect the health and safety of people both in Canada and around the world. Thank you. Merci, miigwech.
Thank you. I believe now we will take some questions. I believe we might have until 1:45 p.m. or so. So let's stick to one question, one follow-up. En question, une supplémentaire. Et
One
premièrement,
question,
je
one
vous,
follow-up.
Annie Guillemette Kojiko.
And we have Annie
Vas-y.
Guillemette from Kojiko. Interpretation will resume.
I would like to know why Canada had to accept the flight that was diverted from the US due to that passenger who was from the Democratic Republic of Congo. I just want to understand like how the decision making works on whether to accept that diverted flights, and in this case, yeah, with the passenger from the epicenter of the Ebola outbreak.
I would have to defer to my colleagues at Transport Canada or perhaps CBSA, but I believe Transport Canada, because those discussions do not fall within the Public Health Agency of Canada's purview.
Okay, and how about, sorry, can I ask a follow-up?
Yes, of course. One follow-up, yes.
Okay. Does Canada need to put in travel restrictions related to the infectious diseases like Ebola?
Travel restrictions are one of many tools that we have available to protect Canadians and respond to outbreaks around the world. We are doing many different things right now, including enhanced screening at our borders. We are partnering with the World Health Organization as well as with Africa CDC to make sure that we have approaches that are based on up-to-date information, based on evidence-based information. And so we want to make sure that we are contributing to the response on the ground to help control the outbreak where it's occurring, as well as having appropriate measures in place so that should anybody come to Canada, that we are ready with our enhanced screening, and that all of our sites across the country are prepared for, should there ever be presentation of a case or even possible case, that they have all of the measures in place to be able to respond safely and protect Canadians and healthcare workers, as well as the individuals who are requiring assistance.
Okay, thank you.
Thank you. We now have Christy Kirkup, the Globe and Mail. Please go ahead.
Hello, can you hear me?
Yes, go ahead.
Great, thank you. Thank you, Dr. Reimer. I'm wondering, you talked about enhanced screening at the border. Can you detail what those enhanced screening measures are and when they came into effect?
Yeah, perhaps I can start, and then I don't know if CBSA may want to add any additional details. So we have added additional screening questions on entry to the country, which as I've just returned from Switzerland, I can personally attest that I was asked additional questions regarding whether I had traveled to the area, whether I had any symptoms that could be related to Ebola. So that is something that is occurring. We've also brought additional staff into our most common ports of entry so that we do have quarantine officials, quarantine officers, sorry, as well as other appropriate staff available to manage should anybody come to the border and demonstrate any risk factors that we would want to have more closely assessed. But I will turn over to CBSA so they can potentially provide any additional details.
No, thank you. So, yeah, we have enhanced our questioning at the primary inspection kiosk and across some applications. And just a reminder, our officers are designated as screening officers under the Quarantine Act and are well trained in the event that a traveler displays any symptoms of illness. Thank you.
I'm just wondering, as a follow-up, when did these measures come into effect? I've just been covering this closely, so this is news. So I'm just wondering, when did this kick in?
I can take that. The enhanced questioning at the ports of entry kicked in on May 20th.
Thank you.
All right. I believe Hannah Alberga from Canadian Press is back. Please go ahead.
Yeah, can you hear me this time?
Yes, absolutely.
Can you hear me this time?
Yes, we can hear you.
Okay, wonderful. Sorry about that, and thank you so much for this update. Dr. Reimer, I just wanted to ask, you mentioned that you're going to be giving advice to your colleagues next week. You know, what would it take for you to recommend a travel ban at this point in time?
So there's a number of issues that are changing rapidly as we learn more about this outbreak. And so it's important that we look at how effective things like travel bans are. We need to be looking at whether or not there is any evidence that the outbreak is escaping the area that it's currently concentrated. We also need to be looking at things like how the virus is spread. I want to really highlight that Ebola is very different than respiratory viruses like COVID. The way that it's spread is from much closer and prolonged contact. And so we do need to manage this virus differently than how we did with things like COVID or influenza or measles. And so there's a lot of different factors that we need to be partnering with the World Health Organization, with Africa CDC, and with other countries around the world in providing the best advice we can to our decision makers so that they can make decisions about border control measures.
And how common is it to test travelers from Africa for Ebola? Like, will this become more common practice now that the outbreak is spreading? It's been considered high risk, as you said. Are you currently testing other people apart from that one person from Ontario for Ebola in Canada?
So testing for Ebola would only be for people who are presenting symptoms that could be consistent with Ebola, as well as an exposure that would put them at risk for Ebola. So for example, someone who has no travel history, no exposure to any other people who are ill with Ebola would not necessarily be tested for Ebola if their risk of being exposed to that virus were negligible. So the individual in Ontario was out of an abundance of precaution because they did have travel to Ethiopia and may have had some exposures there that was individually assessed by their clinician in Ontario, as well as with Ontario public health officials when that decision was made. So we're not testing all people who have traveled to areas where there may be Ebola, but rather testing is reserved for those people who have symptoms. One of the helpful things about Ebola is that it is transmitted only by people who are showing symptoms or by contaminated objects or samples. And so that is something that we are able to reserve for people who are presenting with symptoms.